Welcome back. Hundreds of thousands of people in Ohio, Kentucky, and Indiana currently live with Alzheimer's disease.
That is expected to skyrocket by 2050, creating what people on the front line of the disease call a public health crisis.
And the 9 on Your Side I-Team took a closer look, and they've learned that Ohio is the only state in the nation without a plan to confront Alzheimer's. Investigative reporter Paula Christian explains how one state senator from Warren County is trying to make a change.
John and Bonnie Volz are partners in life. Married for 51 years, they have 2 children and 2 grandchildren. 7 years ago, Bonnie's behavior put their wedding vows to the test.
My grandson called his mom and said, Nana's driven around the block now 3 times. I think she might be lost. And she was.
The Volzes now know Bonnie's forgetful moments were signs of Alzheimer's. Doctors diagnosed her with the disease in 2015.
When you're strong, and when you have your weak days, you're just the emotional up and down.
The couple quickly realized the social stigma that comes with it.
I feel like I don't belong or I shouldn't be here.
When Bonnie tells people she has Alzheimer's, the couple says reactions are often hurtful.
Some people are just roll with it. Yeah. Some people exit quickly. I think they think it's contagious.
State Senator Steve Wilson of Maineville wants to change that. Senator Wilson introduced a bill Wednesday to create a task force and raise awareness.
Every other state in the union has a plan on how to handle this crisis.
At least 50,000 people who live in the tri-state currently battle the disease. Senator Wilson says that number could triple in the coming years.
It is the 6th leading killer in the United States and in the state of Ohio, and the only disease among the top 10 that has no cure or even a way to slow it down.
Paula Kolstead knows about the devastating disease firsthand. She's executive director of the Alzheimer's Association of Greater Cincinnati.
You forget what was said, etc. That's just the beginning.
But for Kolstead, Alzheimer's is also personal. Her husband, Steve, was diagnosed with it at age 50. After a 14-year battle, he died 4 years ago.
Eventually, you lose your ability to speak, walk, talk, swallow, and ultimately lose everything.
Kolstead has also worked with the Volzes.
It's a lousy diagnosis. Yeah. But let's do our best to make it as positive as possible, as long as possible.
They belong to a monthly support group and attend monthly outings at museums and the zoo. But it isn't enough. John looks forward to results from Senator Wilson's efforts to improve services and Alzheimer's awareness.
Paula, I'm really glad we're talking about this. What might a plan look like, especially if you consider like Kentucky? It has one.
Yeah. So Kentucky has a full-time Alzheimer's coordinator that works within an Alzheimer's office of the Department of Aging. So that's a big deal. They also do a really good job of keeping track of statewide statistics. How many people living in Kentucky suffer from Alzheimer's, and are they being cared for at home? And then they try and offer more services for caregivers, such as transportation.
And caregivers can sometimes feel lost in the equation, so services for them, key, right?
Absolutely. It is a tough job.
So timeline, what can we expect in terms of a plan here?
Well, if Senator Wilson's bill passes, it will create a task force, and they will have 18 months to come up with a report and recommendations for what Ohio should be doing to improve the situation for people living with Alzheimer's here.
Okay, Paula, thank you so much.
Thank you.
To learn more about how the Alzheimer's Association of Greater Cincinnati is helping caregivers and people suffering from the disease right now, all you have to do is check out Paula's digital story on WCPO.com. That group also has a 24-hour hotline. Important to share this number. It's 1-800-272-3900.